Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive.
Hello, everyone. I'm Jenna Hagan, and I lead our national sales team covering financial integrity and revenue cycle management here at NextGen Healthcare. This is In Practice, a podcast where health tech leaders, clinicians, and practice administrators discuss the challenges of ambulatory healthcare that practices are facing every day and strategies to overcome those challenges. Today, I'm excited to be joined by two very influential thought leaders in the cardiology space. First, it is Nicole Knight, Executive Vice President of Revenue Cycle Management Solutions and Care Transformation for MedAxiom, an American College of Cardiology company and the premier source of organizational performance solutions for the cardiovascular community. Nicole, welcome to the show. And next up is Dr. Daniel Tarditi. Dr. Tarditi is a non-invasive clinical cardiologist and partner and COO of the Heart House, a leading cardiovascular provider across the nation in New Jersey. Dr. Tarditi, thank you for being here as well. Excited to have both of you.
Thanks, Jen.
Awesome. All right. So today we're going to be talking about how cardiology organizations can meet demand, improve patient outcomes, optimize financial performance, and prepare for the future. We all know that it's all end-to-end, right? Front office operations, all the way through getting the patient in office and prepared and getting them to be treated through there. But there's a lot of hurdles, a lot of barriers operationally as well. As you both know, cardiovascular disease remains the leading cause of death in the United States, affecting tens of millions of Americans. And with aging population and rising rates of hypertension, obesity, and diabetes, demand for cardiovascular services, they increase. I'd love to hear from the both of you. From your perspective, what are some of the biggest implications that's growing this burden for cardiovascular providers over the next couple of years? Dr. Tarditi, let's start with you.
Sure. So I think one of the things that keeps me up at night is the idea that there's one cardiologist for every 1,000 patients currently, and that's only expected to grow in the next 10 years up to almost 1,800. And with increasing age of our population, with expecting to be 1 in 5 over the age of 65 by the 2030, with more comorbidities, more complications, more disease processes, and things that would have been in the hospital now we're dealing with in the outpatient setting. I think this is more of a operational than a clinical problem we need to tackle.
Yeah. Absolutely. It's sounding like the perfect storm, right? Increased patient demand. We've got workforce constraints, rising expectations, not just for outcomes and access, but patient care, access to care, providers to treat care. Nicole, how about you from your perspective?
Yeah, I think in this space, from the demands and the workforce required to support our aging patient population and the continued chronic diseases, really looking at how we deliver care, both proactively and reactively, and what does that team-based care look like? And I think that's going to be crucial as we move forward, just as we talked about with the physician availability and the decreasing availability of physicians.
Absolutely. It's a topic near and dear to my heart. Unfortunately, my father has battled with cardiovascular disease for a handful of years. And one thing I hear consistently is just the difficulty for access, the difficulty not only just to treat the episodic care, right, but the preventative care and what to know and how to manage that as a patient. You get the access, you get the information, you get the care to eat healthy, exercise, don't smoke, don't drink. But what that really means tangibly is also a hard balance for them. And one thing I hear consistently from cardiovascular leaders is that growth isn't just about seeing more patients. It's about doing it without the bottlenecks or clinicians compromising their care or the quality of care either. So balancing those burdens and barriers and hurdles is definitely a complex. As organizations are being asked to care more for patients of the same or fewer resources, What operational strategies are you seeing that help you as a practice or an organization expand without compromising that quality? Dr. Tarditi, thoughts?
Yeah, I'll tackle this one first. Sure. So I think first is making sure everybody operates at top of license, getting more into team-based care. So we pair our APNs in our practice. So we've got 43 total providers, 11 APNs, 32 doctors across 7 offices, multiple hospitals, everything from general cardiology to structural heart. So we have our APNs trained not only in general cardiology, but we also pair them for advanced heart failure, peripheral vascular disease, EP. And that allows us to augment the amount of access we can give to our patients and more touch points, because that's really the key to keep them out of the hospital. It also gets buy-in from our APNs because they know they can advance not just general cardiology, but if they have an interest in EP, et cetera, just like cardiologists. I think also sites of care is going to be key, moving more to outpatient, ASCs and OBLs at a lower cost of care with the same quality. It gives us a big opportunity in cardiology.
Yeah, absolutely. And that doesn't sound like it's happened by accident, right? It sounds very intentional. And a lot of organizations are making that progress or those changes or those influences very intentional, likely by insights or data or visibility that you guys have. Can you share some examples of how data or analytics or workflow improvements have helped you achieve those outcomes or drive towards that pairing and that organizational help there?
Sure, happy to. So we realized one of our biggest sort of pain points was getting access to our EP docs. So about 4 or 5 years ago, pre-pandemic, we started pairing 2 APNs with each EP doc, so they could see them independently as well as in conjunction. And then their knowledge raised, and now they can act and work more independently than they could even 5 years ago. So now we've basically tripled our access in a single day in the office while keeping our providers who need to do procedures in the hospital available to do it. We also saw that our wait time to getting patients to procedures that they needed, whether it was an ablation, Watchman, or other EP procedures, shortened because we had greater access to get that initial visit. In addition, I think we just moved to NextGen in May, and using ambient has been a big lift to help us decrease our workflow throughout the course of the day, allow us to spend more time engaged with patients, as well as less time, sort of what they call pajama time, obviously after hours. So hopefully maybe that eventually will turn into more access and maybe squeezing in that extra patient because it's a little less painful for the provider. So you're not typing all the time and using the technology to sort of augment your abilities without adding additional clicks.
Thank you, Dr. Tarditi. Those were great insights, and it's really great to hear how ambient and all the tools have really helped to drive that improvement. And Nicole, I'm really curious from you if you can share some examples of how data and analytics and workflow improvements have really helped cardiovascular organizations achieve better outcomes from your perspective and what you've seen.
We always talk about purposeful standardization when we talk about doing our work, and top of licensure, as Dr. Toretti said, is crucial. What I would say is the data and analytics, and really looking at how to remove those barriers that keep providers from actually taking care of patients and spending time with the patients. So, what are those things we can do and we can have within our clinics that really help reduce that, such as the ambient documentation tools and many other tools that help that patient have better access to the system.
Yeah, that's absolutely great. Better outcomes, stronger operations, they're critical. They've also translated into financial sustainability as an organization, right? That's equally just as important, especially as you're continuing to invest in care as a patient, but also as a provider in a scaling organization. What revenue cycle metrics, Nicole, do you believe that leaders should be paying the closest attention to right now? And what are you seeing the greatest opportunities for improvement?
Yeah, I think those greatest opportunities for improvement on the revenue cycle process is really those front end metrics. So, what does our eligibility authorizations look like? What is our charge lag? What is our clean claims rates? and really focusing on the front end, because once it gets to that back end, we all know that it takes a lot more rework and a lot more time to be reimbursed, and sometimes lose your revenue, have some revenue cycle leakage. So really focusing on those initial claim edits, those denial rates, and your charge lag, and then also firming up those key processes on the front end.
Yeah, absolutely. There's a few pieces. End to end is crucial for an organization to have that technology integrated, right? And that front end piece that you mentioned is it's probably the most important that a lot of organizations, I think, forget about, right? That insurance capture, but it's not just a patient saying, hey, here's my insurance policy. It's accurately identifying it, having the right payer, the right connectivity, the right results returned, and communicating that back to the patient. Another area, a little bit more the bane of my existence from running an organization is paperwork, and being able to OCR scan and identify and file that paperwork to help drive operational improvement for an organization. Or prior authorization is probably something we could spend a whole topic or a whole episode talking about from a technology standpoint. There's definitely no shortage of technology operations in the market today, or options in the market as well, which can make a prioritization challenge for an organization to choose. Where do you focus? How do you deploy it? When do you deploy it? What pain points are we looking to solve? And how you separate that innovation, excitement, or hype versus what's solving for a real business value. Dr. Tarditi, when you and your organization are evaluating technology investments, what questions should cardiology leaders be asking to ensure you're getting that measurable value that you all are looking for in an organization?
It's a great question, Jenna. So, we're part of a larger national platform, CVA USA, and we realized that all the docs were getting inundated with every email with .ai, and we had to come up with a structure. So we came up with a governance and formed an innovation committee. So the big first thing we always ask is, if AI always existed, would the process even look like this? And most of the time, the answer is no. So the idea is that once you have that, you don't want to just have a broken workflow and then automate it to make an automated bad process even worse. So that's the first thing before you even jump down that rabbit hole. And then we created some governance rules of how to do this. So we have a vetting committee. So there's a structured process, because you want to make sure there's better experience for the patients, better experience for the providers, the APNs. You want better engagement. And those are their first starting points before you get down any rabbit hole. With that, I think Ambient is an example of this. It's a redesign, not just rejiggering a previous broken process. So it's not typing or dictating, and allows you to engage with the patient and be more efficient in your day-to-day operation with a high satisfaction. And in addition, validation, it's got to be a study, not a demo. The demo always looks good, but how does it actually work? And what validated tools do you have? Nicole could obviously delve in. She's an expert in the CCTA and FFR area, so she could tell you about how it looks when a good process is run. In addition, who owns the data from the tool? If we're having our staff putting in information, that's valuable information that we're capturing. We want to own that and use that and not just give it away. And then total cost. Looking not just for implementation, but for model drift, for upgrades, for maintenance. What does that cost look like? Because it always looks great when you first look, and then you get sticker shock if you don't plan appropriately. And then does it move a metric that we're tracking? If they can't name it, then it's a science project. It's not an investment. Is it going to help our time to accounts receivable? Is it going to increase our access? Is it going to improve the quality metrics that we're tracking? And if it doesn't, then sort of why are we doing it? And then last but not least, do you build it? Do you buy it? Or do you co-develop? And that's much more dependent on the roadmap, as well as your own time frame for your institution or your organization that makes that determination.
Absolutely. It's really crucial to figure out that practical path that you all, like you just have walked us through. And you said a word in there too that stuck out to me, which is governance. And governance to you as an organization, operationally, to figure out that buy, build, or partner, co-development path, the value, breaking down that hype and making sure that you're honing in on what value will it drive to your organization is key. There's another key piece there to realizing and adopting AI, and that's governance of the AI itself, making sure it's built responsibly, not just the data and the access of, but that there's ethical use of the AI, right? That it's respecting male versus female and having the visibility and the monitoring and the security, the scalability. So partnering with a tech stack and an integrated technology that helps monitor and build out that responsible governed AI will you as an organization have that governed process and practical path to adopt it is just as important. Nicole, what are you seeing out there? I know we're all getting emails 5 to 10 times a day of vendors,
Yeah,
and
yeah.
so
I
what are you
think
seeing?
I spend a lot of my time with my team that I manage just of the threat of AI. So I think it's important. We talk about keeping the human engaged in the AI. AI can definitely be scalable, but really looking at not adding another disconnected workflow. So truly that integration, governance, a part of the workflow, the buy-in of not only the providers, but also the staff that's going to be using it. Because we often say it's not going to be AI that's going to take over your job. It's going to be those folks who aren't using AI, because that's going to help us scale and be able to truly take care of patients better, I believe, and really using that functionality in an integrated platform.
Absolutely. That work with you, not for you and replace of you is really important. And you'll see that when you start to break down that pilot, that point solution mentality of let me just plug in this and patch that leaky hole in this boat, for lack of a better word, right? And that we try to figure out how to embed it and drive it into workflow and get true orchestration. Kind of a side topic, but I read a really interesting article this morning that relates to exactly what we're talking about. And IKEA as an organization, they replaced over 8,500 jobs with AI, but instead of removing those humans, they retrained them to be interior designers and drove $1.4 billion increased revenue into the organization. So it's just a really great example that AI can drive efficiency, AI can drive improvement of jobs that exist today, but investing in the people like in healthcare to provide the meaningful care, that human touch that is still needed for patients day to day is a really important piece to remember. A lot of people get caught up in that hype of AI and worried jobs will be gone or how it's going to replace me, or Dr. Tarditi forced me. I remember a year ago, providers like, you're going to change how I practice. You're going to force me how to practice and what I've been doing for 30 years in documentation. And that's really not, the reality of it when you get down to that practical path of adopting. It's how can it make me a better provider? How can it make me not have to be here until 9 p.m. and document those charts, right? There's some also really crucial conversations at a recent conference that I attended where the battle of the payers and the battle of the bots, as you call it, or AI. And um, when you look at the denial rates, a lot of organizations that have adopted clinical AI or like an ambient, like your organization at the Heart House, they're seeing improved denials and their denial rate dropping, not because, the payers are being nicer and accepting it, but because the documentation's more detailed, it's more meaningful. And they're questioning some of the coding, and you're seeing some of those immediate denials because they're like, where'd all this up coding come from? Why are you charging more? But really, the technology is helping to drive more accurate, more detailed, and say, hey, you might not have been billing this for the past 3 years of practice, but you should be, because here's everything you just did for an hour in that exam room with that patient. So it's you're seeing a little bit of a paradigm shift there too, and you're always going to battle the payers, but I think it's important to just kind of keep some of those key pieces in mind when you're going down that path of adopting AI and considering. If we step back from today's challenges a little bit and we look kind of around the corner of what does success look like and what will it require of organizations over the next several years, what capabilities are most important for cardiovascular organizations to remain competitive and remain successful? What's your viewpoint, Dr. Tarditi?
I think it's getting your hands around your data, number one. Otherwise, it's just garbage in, garbage out, and you can't go by feel. I think Nicole hit a good point that I want to bring up again is that 80% standardization that you can use with that 20% flexibility at the provider level, because there's a lot of things we can standardize and operationalize to improve the quality of our patients, as well as also decrease clerical work by standardizing processes that are clear cut. Classic is heart failure. I mean, it's just in essence following a recipe for the most part, but that's what leads to better outcomes. I think getting data, we are on several disparate EHRs currently in the national platform, trying to get that information to one source of truth in a data lake that we can use as a unifier until we can move to more of consolidated central EHR, I think is going to be key, because you need to have your data to drive outcomes. We're getting into value-based care, CINs, ACOs, and with access coming down, the ambulatory specialty model, you're going to need that data to be ready as opposed to being reactive when the time comes in 2027.
Yeah, that's exactly right. And better outcomes, absolutely. But also as AI scales back into the technology and really starts to be that orchestration, right? That it needs that for context. It needs to know where it came from, what it means, where it needs to go, and what to do with it to start to drive staff into workflow. Today, providers quite literally count clicks, right? That it takes to go look at a medication or go look at a diagnosis. And the system has that data. But when you have other systems and other platforms, you need to pull that data together to be able to connect it. So the technology knows where to drive you, where to recommend you, and where to put you into workflow. That's a big factor. It's not just helping you document faster, right? It's what's next. What do you need to do, and not make you have to think to go click there or go find it in a module. That's really important. Nicole, how about you? What are some areas that are important to consider for success and differentiation as an organization?
Yeah, I think, when we do our top priority survey, we always get access as number one. And I think access is not just getting in the office to see the physician, it's managing those in betweens, having my phone calls answered. What is the automation and how can we use that around referrals, coordination of care, and truly looking at that work life balance for everyone, not only our clinicians, but also their support staff within the clinic. And what are those tools? I think that's going to be essential moving forward. We need an easy button. I think the data is great. And I think having that data and making it transparent and easy to understand and not overwhelming is also important.
Yeah, that's exactly right. What gives the both of you the most optimism about the future of cardiovascular medicine?
I'll take this one first if that's okay, Nicole. So I'm excited because even though the shortage is real, the leverage is also real and the opportunities. The younger cardiologists coming out now are all eager to build their own systems, and now you can actually do this. What used to be we'd be sitting with a poster board or a cocktail napkin now can be vibe coded in Claude or Gemini or pick your platform to really do a proof of concept. You have to be cautious at the same time because healthcare is messy and dirty, and you don't want to expose, you know, PHI by any means. But in the same token, it allows you to sort of look to get to, coming up with prior auth ways to work that, coming up with something that works within the workflow. Because the biggest problem with this, some of these nudges, as we know, is you get numb to it because it pops up at all the wrong times. So figuring out where it fits into those workflows as well to really augment your staff and improve efficiency and have the AI lift them up as opposed to replace them, I think is going to be the key. But that's also very exciting. There's a lot of possibility for us to do this. And I think we haven't even scratched the surface. To Nicole's point about the proactive outreach, taking in those ADTV data that we have and creating a system that automatically reaches out and knows that when I see Joe in the office, he was in hospital X and those records are already there for me. My staff's not going to chase those down or find that out. And then also providing that access for the patient. So after they come back, or the question they always have, there's always two questions they have that they forgot to ask when they're in the visit within 24 to 48 hours. And then they're trying to get back to find out about it, right? So providing them that access and figuring out the most efficient way to get them the information they need in the format they want, I think is going to be key.
Absolutely. How about you, Nicole?
Yeah, I would say obviously keeping up with the innovation on the clinical side is very exciting as well, with things that are happening both in structural heart, EP. I also think from what Dr. Tarditi said about moving to the outpatient setting, that's very exciting. How are we going to do that? What does that look like? How are we going to leverage digital health to help with that? And I really believe those things are exciting as we continue to look at the innovation happening in healthcare and also those new fellows, those new graduates coming out in healthcare and really driving some of that innovation.
Yeah, being eager to adopt and help us move forward, which is incredibly exciting. Well, Nicole and Dr. Tarditi, it was really great having you today. Thank you so much for being on the show. Great insights, great discussion. I'm sure we could talk for a whole day's worth of continuing to dive deep, but I've really enjoyed the conversation. And listeners, thanks for making time to join us for today's episode of In Practice. Be sure to subscribe to Apple Podcasts or Spotify so that you never miss an episode. And until next time, thank you all.